A cleft hand is a malformation where the division between the fingers extends into the metacarpus. The middle digits may be absent and remaining digits are abnormally large. Repair cleft hand. The physician incises the overlying skin and dissects to the deformity. The tissues are brought together with sutures, and the tendons are approximated to produce tensor and extensor function. Following correction of the metacarpus, the skin is reproximate, reduced, and sutured in layers. Plastic repair of cleft lip/nasal deformity, primary, partial, or complete, unilateral. Primary bilateral, one-stage procedure. Primary bilateral, one of two stages. The cleft lip is repaired first and nasal deformities are repaired in a second surgical session. A cleft lip may range in appearance as a notch in the upper lip to a complete separation running into the nose. The cleft margins are incised on either side from the mouth toward the nostril and through the full thickness layers of mucosa, muscle, and skin on both sides of the face. The vermilion border of the cleft lip is turned downward to restore the normal shape of the lip, and the muscle and skin are brought together to close the cleft separations on each side and preserve muscle function. The nasal deformity often caused by the cleft lip may be repaired. The physician closes the prepared margins in layers from the intraoral mucosa through the muscle with final closure of the skin. The second surgery is performed after adequate healing of the first surgical site. Plastic repair of cleft lip/nasal deformity, secondary, by recreation of defect and reclosure. The cleft margins are recreated to define clean edges for the defect through full thickness layers of mucosa, muscle, and skin. The prepared margins are again closed in layers from the intraoral mucosa through muscle with final closure of the skin. Plastic repair of cleft lip/nasal deformity, with cross-lip pedicle flap, Abaeus-Linder type, including sectioning and inserting of pedicle. The cleft margins are incised on either side from the mouth toward the nostril and through the full thickness layers of mucosa, muscle, and skin. The vermilion border of the cleft lip is turned downward to restore the normal shape of the lip, and the muscle and skin are brought together to close the cleft separation and preserve muscle function. A pedicle flap is designed from the lower lip based on blood supply. The flap is created with a full-thickness incision and rotated on its pedicle to the desired location. The flap is sutured in layers to the recipient tissue location. The prepared cleft margins are closed in layers from the intraoral mucosa through muscle with final closure of the skin.